For decades, Montana has ranked high on the list nationwide for suicide rates. Take a look at some of these findings from the Department of Public Health and Human Services. Suicide exceeds car accidents as the #1 cause of injury-related deaths in the United States. It is second leading cause to death among young adults ages 15 to 24. And 1 in 12 of college students has made a suicide plan. More than 1,100 students will follow through with taking their lives. But officials say Montana saw the second biggest increase in call volumes to crisis lines last year, a 43% jump from the year before. MTN's Keely Van Mittendorp spoke with 2 prevention experts working to combat the threat and stigma around suicide.
Crisis line, how may I help you?
The people that call me and call our line are not weak. They're probably some of the strongest people that we have out there.
Voices of Hope director Jackie Gittens says that a conversation can make the difference between life and death.
Getting that emergency, that threat of somebody's life on the line, immediately off the table.
Voices of Hope answers crisis calls from over 40 counties in Montana and also operates a national hotline.
16 to 20, as high as 24% of the calls we receive are related directly to suicide.
And while economies and geography vary by county, the reality and pain of suicide is shared by many statewide.
Live in a city, live in the country, it doesn't matter. It can happen to anyone at any time.
Suicide also affects every age group, but continues to be a growing threat to the younger generation.
Young adults, 15 to 24. Nationally, there's been more than a 200% increase in the last half century.
Both Gittens and Roston say a lack of coping skills and learned resiliency are big factors unique to young adults and suicide.
College kids that go to college and they're not succeeding like they did in high school or in their smaller communities, and now they feel like a failure.
Those serving our country are also fighting an uphill battle.
We lose more airmen to suicide than any other single enemy, even more than combat.
As of August 1st, Air Force officials say 78 airmen had taken their own lives, nearly 30 more than had died by suicide in the same time last year.
78 teammates, that's 78 wingmen, that's 78 spouses, that's 78 brothers and sisters and sons and daughters, 78.
In response to this year's rising rates, officials have ordered all Air Force units to stand down for one day to focus on resiliency and suicide prevention.
Crisis line, how may I help you?
While experts are seeing an increase in the number of suicides, they're also seeing more people reach out for life-saving help.
With the text line, we saw in the last 3 years, we saw a 105% increase in the volume of calls, and 80% of them are under the age of 24.
And just in the last quarter, we took over 1,600 calls just on the Lifeline.
She says simply getting a caller in crisis to open up about suicidal thoughts can be life-changing.
Is that really what you want to do, or is the pain just so harsh right now? What can we do to alleviate the pain?
Reporting in Great Falls, Keely Van Mittendorp, MTN News.
Now, MTN did reach out to Malmstrom Air Force Base for comment about suicides on base. We did not hear back from officials. You can call for more, or you can find more information about suicide rates at krtv.com.